The biggest budgets, health remains a struggling sector in this country. The necessary outcomes seem to remain out of reach. Health portfolio MPs gave the New Zealand delegation some background.
All the programs that have been put in place, developed by the Department of Health, implementing them, we are overseeing them. It's because, among other things, we are addressing and correcting the past that we are from in terms of the sector.
The second largest component of our national budget is spent on health. It sits at about 182 billion rands, consisting of direct expenditures and conditional grants. But yet our health outcomes are really poor. We have considerable assets in terms of the health infrastructure, but it's not up to the task.
The counterparts from far down under gave some insight.
What we're much more focused on now is outcomes. So being actually quite clear about outcomes. Because when you've got a clear outcome, you can actually start to work out the intervening strategies you have to put in place to achieve those outcomes.
South African MPs were particularly keen to hear how New Zealand has been dealing with HIV/AIDS and anti-smoking legislation. In a country of around 4.4 million people, New Zealand currently has around 2,700 people living with HIV/AIDS. It puts this down to its distance from the rest of the world and its early interventions in terms of ARVs. Less than 5% of the country's population smoke.
We have also increased taxation on tobacco each year. We have an increase in the excise duty that is put on tobacco. It's been at 10% increase each year. We're waiting for the next budget to see if it is increased for the next 3 or 4 years. So we've been doing it in blocks of years.
What the two countries do have in common is an ailing nursing sector. Both see their nurses seeking better opportunities in richer countries. But New Zealand is running programs to specifically recruit members of the Maori communities to enter medical schools. Rababia, SABC News, Parliament.